Hello, I'm Dr. Gaile Robredo-Vitas, and today's topic is very exciting for me because I'm gonna discuss two of my favorite procedures in my clinic: botulinum toxin injections and filler injections. For those of you who are very familiar with the two and you come to the clinic, alam nyo na kung anong gusto nyo, Doc, I want Botox, Doc, I want fillers, you don't need this anymore. But for those patients who are just starting to enter into the world of injectables, medyo nakakalito siya. It can be confusing. So in this video, I'm gonna talk about what botulinum toxin or Botox and fillers are, their similarities, their differences, and their indications. And because I'm a dermatologist, I will be focusing on the use of botulinum toxin and fillers in the field of dermatology. Hopefully, by the end of the video, if you were thinking of getting any of these treatments, I will be able to help you decide which one you need, and who knows, you might even get both. First, let's start with similarities. They are both used as anti-aging treatments. They are both used to enhance certain features of the face. Both of them can improve functionality and quality of life, so hindi lang siya pampabeauty. They are minimally invasive treatments that are done usually via injection and in a doctor's clinic or doctor's office. Now to talk about their differences. First, let's start with botulinum toxin, or what is commonly referred to as Botox. It comes from a purified toxin from a bacteria called Clostridium botulinum. When it is injected into a muscle, binablock niya yung nerve signals that cause our muscles to contract, hence paralyzing it. In effect, some lines and wrinkles can be softened or reduced, and some of them even removed. Ang kailangan lang nating tandaan is that botulinum toxin injections only work on the muscle. Only lines and wrinkles caused by muscle movements such as your frown lines can be effectively addressed. Hindi siya nag-work dun sa mga lines and wrinkles that are caused by sagging or loss of volume, for example, your nasolabial fold or your marionette lines. And hindi din siya nag-work dun sa lines that are there when you're not moving, or what we call static lines. Botox can also be used in other non-cosmetic indications. For example, yung excessive sweating, so it can be in the underarms, on the palms, on your soles. I also inject some of my patients in the masseter muscle or the jaw muscles for those who grind their teeth at night. Ang magandang side effect lang nito is that when you have a square-shaped face, mas magiging V-shaped siya, or yung tinatawag nilang contoured face. Results from botulinum toxin injections are not instant. You typically have to wait anywhere from 5 to 14 days before you see the full effect. Results are not permanent, and retreatments, kung gusto mong ma-maintain yung effect, are done every 3 to 5 months. Now we go to fillers. Fillers are substances that are injected or deposited beneath the skin. Ginagamit siya for loss of volume, or if you want to enhance certain features of the face such as your chin, your lips, or your nose. Iba't iba ang klase ng fillers out there. The most common are what we call hyaluronic acid fillers, followed by biostimulators. So example nito are your calcium hydroxyl apatite, and permanent fillers such as your silicone. Results from filler injections are almost instant. The moment you inject, you can already see kung ano yung magiging effect niya. How long the fillers will last will depend on the type of filler and its individual characteristics, but usually they last anywhere from 6 to 24 months. Isa sa mga valid concerns of patients who want to get Botox injections or filler injections is the safety. I can confidently say that both treatments are very safe and very effective, provided that they are done correctly by a well-trained and well-experienced injector or administrator. A good knowledge of anatomy and a good knowledge of how these substances work can produce great results. But even though they are both minimally invasive, meron pa rin siyang mga risks. So ano-ano ba yung mga to? Of course, there can be some pain and discomfort because it's administered through injection. You can also have some swelling and minimal bruising. In the case of your Botox injection, some patients, when they treat their forehead, may experience a headache-like sensation a few days after the treatment. But this is not permanent and it goes away after a few days. Some of the undesirable side effects of these treatments may also happen. For Botox, there can be asymmetry or yung hindi pantay. There can be drooping of the eyelids and muscle weakness when the product diffuses or kumalat dun sa mga katabing muscles or muscles that you don't intend to inject. With fillers naman, undesirable side effects include blindness when the filler substance is inadvertently injected into a blood vessel. There can also be tissue necrosis when the filler occludes or blocks blood flow to certain areas of the skin, lumpiness or bumpiness or uneven product placement, and sometimes what we call Tyndall effect when products are placed too superficially. Allergies and nerve damage, you may read about it, but they're very rare. The easiest and surest way to avoid undesirable complications is to go to a qualified, well-trained injector or administrator such as your board-certified dermatologist or plastic surgeon. Botox and fillers, unfortunately, are not for everyone. We don't inject individuals who are pregnant or breastfeeding, and those with existing inflammatory or infectious conditions on the sites to be injected. For botulinum toxin, certain health conditions such as myasthenia gravis and other neurological conditions are contraindications to the treatment. If you have known allergies to any of the component of the toxins or the fillers, you're also not a good candidate. Expression lines or lines caused by muscle movement are treated with botulinum toxin injections. Lines and wrinkles due to loss of volume and sagging or enhancement of certain features of the face can be effectively treated with fillers. Because botulinum toxin injections and fillers are different substances designed for different uses, they can actually be used in combination with one another. Kailangan realistic ang expectations mo when you want to get these treatments done. Although they can both enhance and improve the way you look, the results are typically not as significant as having a surgical procedure such as your facelift. So I hope that for those of you who have been wanting to get your Botox or filler injections but do not quite know the difference, sana nakatulong itong video na to sa inyo. Before you go, please don't forget to click the subscribe and the like button. I will continue to make informative videos about the skin for you.